I've done bariatric surgery in children as young as 4 years old, safely and with great results, actually. Weird, right? Like, it's kind of unbelievable to think about, really. And it's not just like one, it's like a number. So it gives me a completely different perspective on obesity in general, right? Because I've been fighting for patients and children to get access to obesity care for my entire career. And when that care is necessary in a kid as young as 5, you can imagine there are a lot of people out there who are not supportive of that idea. But I can assure you, for some forms of obesity, for some of the different causes of obesity, weight loss surgery, bariatric surgery, metabolic surgery, whatever you want to call it, surgery for weight management is the best way to help those young kids. And hopefully you can tell that all I've ever wanted to do is help kids or help people who suffer from obesity or both. Like, that's the goal here. That's what we're trying to do. Today we're going to talk about surgery, the different forms of surgery for weight management. I'm Dr. Evan. I'm the pediatric bariatric surgeon who's done more operations for weight management than anyone in this country. And that's why my perspective is different than some of the so-called pundits. It's going to sound funny because I'm on a YouTube channel, but don't believe everything you see online or hear online, unless it comes from me. So bariatric surgery, which is the surgery, it's a general term for weight loss surgery, which really should be called metabolic surgery because we don't do it for weight loss, we do it to make you healthier. Another topic for another day. But it's been around. It's been around for a long time. First report was in the 40s and it had 90 or so patients in it. And that's a published study that I could find, like when I go onto the internet and search the search engine that we use for medical publications. So it's probably around longer than that, just no one had published it before. And it's had ups and downs. You know, if you're an adult watching this, you probably remember, you know, when the operations were done with a big cut across the stomach instead of with the camera and tiny little incisions that are like that big, and the complications that patients had. But things are totally different today. There was also the whole era where we were doing maybe weight loss surgery without the proper wraparound services, and that's another whole topic. Like, you shouldn't just get surgery, you need all the other things we've talked about in the other episodes, the diet, the exercise, the medications, the mental health support. It's a whole thing. It's not just an operation and magic bullet, you're cured. It's part of a treatment algorithm that encompasses a bunch of different providers, a bunch of different people, you, your family, your community, but also doctors, nurses, dietitians, nurse practitioners, psychologists, psychiatrists, anything you need or everything you need. So the surgeries today are done what's called laparoscopically. It's a camera that goes inside your abdomen and looks around. It's actually pretty cool. You can find some videos, or maybe I'll put some videos up for you guys to see what that looks like. And with that camera, you put in other small, what are called ports, and through those you put some instruments that kind of look like chopsticks, more or less, though they have little graspers on the end or little other things that they can do on the end. And with that, we can do a bunch of different operations, both bariatric surgery and others. If anyone out there has had their appendix out or their gallbladder out, it was probably done laparoscopically. But for discussion for today, obviously we're talking about weight loss surgery. And there are two major operations that have been done over the years. The one that was the most famous was the gastric bypass. That's the one that had a lot of bad press back in the day, and it was deserved, some of it. But it was thought to be better, or shown to be better than not treating obesity. And that's why actually in 1991, which is over 30 years ago, that's when the NIH, National Institute of Health, that's when they first had a consensus conference with providers who are expert in the disease, and they said that surgery was worth doing to cure obesity. Now, most of the surgery that gets done is a procedure called the sleeve gastrectomy, and that's all I do for kids, and actually that's what most everybody does for kids. But even 70% of adults get that procedure because it's safer, and it actually is almost as good in terms of how much weight you lose. And that operation is basically, we just remove about 80 to 90% of your stomach, which sounds crazy, but actually it works really well. And it works in large part because you're not hungry all the time and you can make better choices and modify your behavior with that operation. The bypass makes your stomach smaller so you eat less, but then has another component where you don't absorb some of your food, which helps for weight loss, but can make nutritional problems more prevalent. So again, I'm not here to tell you what procedure. I'm not here to tell you if you should get a procedure or not. These are things you need to talk to your team, your doctors, your providers about. But if you want to hear more, if you want me to do a bigger, deeper dive, like, comment, post, share, subscribe. But tell me, put it in the comments that you want an episode on, the sleeve gastrectomy in detail or something else, anything that we've talked about. Obviously I'm a surgeon, so you might think that I believe surgery is right for everyone. I don't believe that. And I really believe what patients want is what's right for them as opposed to what I think. And medication, again, right for some, not right for some. The two of them working together, that's what we do when we have the most severe form of the disease of obesity, and lots of people need it. We don't even know if it's better to have medication, surgery, or surgery, medication, or medication, surgery, medication. We don't even know. So we're doing the best we can. So choosing one or the other, probably not even a relevant question. It's probably just, what are you ready for now? And let's get started. If you like what you're hearing, got more to talk about, again, share with your friends. Give me some feedback. Comments are super helpful. I'll change what I'm doing. Happy to. Subscribe. Share it with people who you think need to hear it, even if they don't want to, okay? And remember, obesity is a disease, not a lifestyle choice, and there's something you can do about it. So we'll see you next time.